चुप माही चुप है रांझा, बोल कैसे वे ना जा, बोल कैसे वे ना जा, जा।
Hi, everyone. All right. So our event is even, I think everybody is here. Yes. Just waiting for our guests to come. All right. So we are even live on YouTube. So in case anybody wants to be part of this conversation that we will have, yes, our guest is here, everyone. Pooja, can you come on video, please? And Priyanka, can you post a YouTube channel, that link in the group, in the mastermind group? So in case anybody want to watch from the YouTube, they can. Okay. So yes, Pooja is here. All right, Pooja. That link in the group, in the mastermind group. All right, Pooja, can you unmute yourself?
Yes. Thank you.
All right, thank you, and really welcome in our community. First of all, everybody, let me introduce Pooja. So Pooja is Dr. Pooja, and she's a gynae, and she has her own nursing home, and where she worked with her mother. She and her mother runs that hospital and a nursing home. So in fact, I would not say much about her. I would rather give this opportunity to Pooja herself. And Pooja, why don't you introduce yourself a little bit about, what do you do, and the where you from. And uh, one thing I would like to hear from you is that today a lot of my students are going to be here, right? And a lot of people are also joining and also watching. A lot of people are watching YouTube right now, and we are on live on YouTube right now. As today is Women's Day, International Women's Day, especially this day is, it's not that we only celebrate only on this day. We celebrate Women's Day every day. Women is, without women, I think the society can't run, of course. But then today is a day of acknowledgement. This is how I always feel, that like we acknowledge ourselves, we look into ourselves, we maybe it's a time for us to introspect ourselves in terms of where we are and what we can take care of it. So on this very beautiful day, I know having you is definitely an amazing, and very fortunate to hear that from you about women and health, right? It's one thing that all my students, in fact, when I ask people, to all of them, what is that they want in today's discussion. So they have given a couple of topics where they would like to hear from you about, related to women and health. So yeah, I'll give a word to you and introduce yourself and give your, what is your take on about, uh, various aspect of how, what is that women need to look after, women need to look, understand about herself, and what are the important aspects that we women sometimes tend to forget when it comes to ourselves, right? We are such a nurturer, we are such a giver. We give giving, we give nurturing, we give sharing and caring for everyone, but sometimes when it comes to ourselves, we sometimes forget ourselves, sometimes we forget to take care of ourselves, right? The whole event today is all about that. Like, I want you to share um about those aspects about women, right? So thank you for accepting our invitation, for having us, you having here in our community is really amazing. So thank you. Welcome.
Thank you. Thank you, Sophia, first of all, inviting me here and being amongst you all wonderful people here. And before I introduce myself, let me, wish each one of you, I see few of you here, Raksha, Ritu, Jayashri, Soma Bhagat, and all of you, a very warm and a very wonderful Women's Day to you all. Wishing you a great one and be great every time, how you have been so far. So let me tell a little bit about myself. I know Sophie has already told that I am Dr. Pooja Patil. So you are all ready with your questions. Like, we will ask, there's a doctor with a lot of questions regarding health, which we all are dealing with. I'm right here to serve that to you. And before that, as said, I'm Dr. Pooja Patil. I reside in Hubli, Karnataka. I live with my supporting and loving parents, and I work with my mother, who's been running a maternity and nursing home since 41 years. So I have been practicing a freelancer more than 7 years now. And my forte is that I'm a great emergency, what you can say, delivery doctor who handles all the emergency cases at a very cool pace. That's what I get so soon. And apart from that, I'm a basic infertility counselor. I do sex and intimacy counseling for couples too. And I also bring awareness in the society about what it means to be when it comes to your health, when it regards to you, where you need to recreate yourself. That's where I look upon, and I would love to create the same thing to you all today. So as Sophia said that, let's walk our life, as a woman, like you're born, you're born as a sister, right? You walk through your pubertal age, you walk through your pubertal cramps there, you are menstruating now. So I guess all of us would be going through that. Few of menstrual cramps, what can we do that time? Few of you come with your home remedies saying that nimbu pani, that's good one. Apart from that, what else can you do? How can we avoid painkillers? Painkillers are not that harmful when you take during your menstrual cramps. What can you avoid that time is that lot of physical exertions. When it comes to girls who are into sports activities or women who are doing a lot of household works, just take care of yourself, that pace of your life that time. And then when you come to your reproductive age, when you're menstruating, I would advise you, do not have intercourse, so that it helps you to avoid any other pelvic inflammation there, and you have a peaceful of menstruation there. And when it comes to your other household, whatever tips you have, like you having warm water, hot water bags, or you are hydrating yourself, all those. I guess few of us do even practice mudras also, so that the cramp release and all. Whatever, soothes you, go ahead with that. The best part in the cramps is when I want to talk to you in a technical language is pain, cramp related to uterus, it's always related to prostaglandins. To reduce prostaglandins, the best part is to provide a lot of oxygen to it. How can we provide oxygen now? Breathe. Do a lot of your, you have your coach who keeps teaching you about all meditation and all. That does help to you. And when it comes to menstrual sanitary pads. These days, we are being, advertised with a lot of this, fragrance and odorful sanitary pads. As per the recent guidelines, we are coming back with the menstrual cups now. It's silicone based, very easily usable, and can be cleaned every 6 hours. And when you're not using it, just clean it with the hot water, keep it in a, dry it and keep it in a safe cover pack, and then use it back later. So this is something when it comes to your menstruation. So now let's walk in our reproductive age group. I would say that this is the best age where every woman is in a best phase of her life when it comes to looks, when it comes to everything. These are the times where you suffer from a lot of acne, some unwanted hair problems, sometimes, abscess in those areas where you are not comfortable to show up. So what can you take on when it is in your lower part? Try using a lot of cotton panties, which helps you to maintain a great pH level below. And when it comes to using these vaginal washes and all, I would recommend you to use the normal water which you can clean yourself every time. Washes are still a contradictory. They do say that it maintains the pH level, but I personally feel that old standards, I can say, is that a woman's pH level cannot be same and cannot be same in a same woman all the throughout the day. It's completely hormonal based. So what is best is you keep yourself hygienically by cleaning with a routine normal water. And please avoid using Dettol there or any other, irritant. And if so, ask your doctor, take a prescription, and where and at what level you need to apply it, please do use that. So now, when you're married, so most of the women in their sexually active life, none of you are aware about, something called as cancer screening. Everyone talks about it. Let's know what is awareness and all. But would you like to listen something saying that, wow, it's a normal report? What's that report? It's called as pap smearing. Every sexually active woman, right, from your till your premenopausal age, once in 3 years, go ahead with your pap smear test. Consult your gynecologist, get yourself internally checked, and be happy to celebrate that it's a normal report each and every time. And if there is something there, it would be diagnosed at an earlier phase of your life, and which can be treated. Nothing to, feel that we didn't get a chance to know about it. As there are advanced methodologies there in treatment aspects for it too. There are cold therapies. There are even screening that helps in going for, medications, hormonal treatments we give them. If not, further by the mapping, we go ahead with the surgical treatment too. So then next comes the favorite part. Everyone would love to hear this, being a mother. The first news which every woman blooms up is listening this urine pregnancy test positive. Even the actresses these days are loving to ad film this. So what's so special about this is this completes your journey, a satisfaction which makes you live that for what purpose you are in this world. And most of the times, what I hear these days is the juggle. I'm a working woman. I do understand this part. So there's a juggle this that, how can I manage my work life and my pregnancy? No, no, no. Let me not, have this pregnancy right now. Let me ask, will I bloat up? Will my breast sag? All these constraints, which is keeping on making you think, should I go ahead? And sometimes you're overexcited. Let me go ahead. These are all your hormonal changes, which comes through your level of accepting that factor of being a mother. But I would say that none of you would be saying that I don't want to be this. So when it comes to, let us take on the positive side of this, that once you're a mother, during your pregnancy cycles, whatever comes in, The new era in these days, in this almost a phase of decade, I can say, is that there is an increasing trend of we seeing hypothyroidism or any other thyroid disorders in women. We see even, gestational diabetes mellitus. Okay. And we also see pregnancy induced hypertension. So these are the three things which particularly the Indian women are hitting to a next level. So what can we take care here is that the anxious level, what you deal with, I really want each one of you to work on that aspect. None of us are born with thyroid problems. And if you're so that, you would be pre-guided to do what you need to. But you getting in your pregnancy field, when you're having your baby and you're ending up with these things, then it's 100% that there is some metabolism, going hayway. So what next can be done is that, what new natural level of treatment, because pregnancy is not a disease, it's a physiological phenomenon. And what can we take care in this pregnancy is that whatever to what level you can work physically, do not strain yourself, do not over comfort yourself also. Okay. And at the same time, keep yourself soothing all the time. What do I mean by soothing? There are a variety of therapies which, I do suggest my patients. There is music therapy. There are people who love chanting, people who love to listen to music, people who love to read, variety of their books with related to their religion, or listen to it at least. These are one things. Visiting the places where you feel a kind of soothing also. This is a period where you would love to listen to all those things where you feel the vibration coming from your baby, and it makes you feel that you're connected to it. So next, when you see this music therapy and all, there is something called as pregnancy induced swelling and all. I would suggest you to go on a barefoot where there is small stones. Just have a barefoot walk. And then when you come to your other things like drinking water, oh my God, this is a challenge for every doctor. We keep advising drink water, drink water. And they keep saying, I drink a lot of water. When asked, they say that it's just 1 or 2 liter water. Please do drink lots of water. Water is something so important to you is that it requires a lot of amount of your body to accompany that big baby which is going to grow inside, and also facilitates the growth of your fetus, that's your baby, and helps it in breathe well, and also helps it bring in other reflexes which is related to its brain. Okay. And when it comes to the delivery part, it eases and glides in delivery. So that's what we require, you asking you to drink lots of water. So when it comes to your other aspects, like when do you have or you would love to have a baby, what do you need to take care? Just be ready to just go for a trial of labor. I know C-sections are there all the time and doctors are there to operate to you, to save you and your baby have a great life. But at the same time, what I suggest is you partnering them. When you partner them, just give a try. It's never forced to you. Give a try. If you can, and your period and your journey while you're delivering is safe, it goes very smooth. Don't give up so soon. You have walked a 9 months path there. So what next? When it comes to the soreness of the healing part of your cut part during delivery or the wound of your C-section, you need to really take care of those parts, not applying anything whichever you want. Okay. Consult your doctor asking what medication, what ointment, what things need to be applied. And when it comes to your belly fat, I listen from many of them saying that, Madam, This is my belly fat from my previous pregnancy. No, 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 no. It's all the extra fat which you ate. Eat healthily. Eat healthily. What do I mean is a kind of food which is required to. Great, eat all the laddus of ghee, which is made of, but not the whole pot of ghee. Okay. Don't make yourself someone who is going to glide and, fill in with a lot of fat there. And then comes to your care of your belly. That is, wear a belt. Okay. Don't tie something where it increases your cramps, your uneasiness, and all. And whenever you would love to go for a small massages and all, you can go ahead after 6 weeks. And even if you want to revert your sexual abstinence, you can have it after 6 weeks, or whenever advised by your doctor with regards to your ailment, whatever you're dealing with. So now comes, this is one thing which we are all hearing: postpartum depression. What is depression, guys? You tell me. You have a live baby in your hand. Why are you depressed? Or there's nothing called depression. What are you prioritizing there? And what are you demanding from people to make you wear a crown is what I ask my patients. There is something which you all deal is, I have walked through a 9 months journey and no one asks me. Every importance is given to this baby, or it is resembling my husband or someone else, but not me. What I would say is that all of you should pat your back, because no one has that courage to have, nearly 4 kgs, okay, the 3 or 2.5 kgs baby and all other things, carry that in that belly and walk around against the gravitational force for 9 months. So, that's something so, so great about each one of you. And when you walk through your life as a mother, there are so many ups and downs. When it comes to your breast care, what aspects you need to take it is feeding your baby. How frequently? In the beginning, once 2 hours, every 15 minutes on either sides. And when you keep feeding and feeding, I hear about this breast pumps and all that. I don't know how far that can be useful for you, but if it demands you that your work matters and you have to take care, use them very little. Okay. And when it comes to your baby, you are the best person to take care. No matter what, how many mistakes you make, still it is in the safe hands, no matter what. You touch, miracles happen there for it. You walk through your next is your premenopausal phase. Premenopausal period is where you deal with your lot of ailments. That is where you have overstretched yourself. Where do you stretch yourself is your back. You hit your back to such a level that you are either arthritic, osteoporotic, or some spinal problems. So when can you start taking care of your back? Or if I say on a very nominal level, is that your calcium levels. Start taking calcium supplements from your age of 30 plus, and evaluate yourself. Get evaluated for your bone mineral density every year. If I would love to say you that something, make a record of your, hemoglobin, because you're menstruating, and your your bone mineral density. Okay. And if you are thyroid or any blood pressure or anything, keep a record of it. Monitor yourself so that you get a hang of where and when are you having a rise or a fall in it. So now comes the menopausal period, the dry period, the thing which many women don't talk about, with vaginal dryness, the irritational, the mood swings you have, the hot flushes that you deal with, and with all the osteoporotic, that is bone problems you deal with. This is a period where you require support, you require counseling, you need to talk to your gynec most of the times. Take few antioxidants, take few calciums, certain isoflavones that help you to recover from that period of menopause and move very easily through it. And then is your postmenopause. Postmenopause is dealing with all your fragileness. What is the fragileness? Is your skin. You are still beautiful with that wrinkles. I am not against people who are using Botox, but you're still beautiful, those wrinkles. And other things when it comes to your other private areas also, where you feel it's sagging and low and all, it's still okay. What do I want to convey to you all is, in whatever phase of your life you are still the best. And whatever you're going through, every ailment has a solution for it. Only thing you need to go for yourself and ask, do I want to get treated? And if you want to get treated, whom do you need to approach to? Either a doctor, a friend, a counselor, a meditation guru, anyone, your mother, your friend, your siblings, your spouse, anyone. So that's what I want to convey to you all. Thank you.
Thank you, Pooja. I think, Pooja, you covered everything.
I covered everything.
Yeah,
Okay.
yes. You covered the entire cycle of a woman, like, from the time when we are born till the time when we are getting old, and what all the phases that every woman go through. That's so beautifully you in fact, summed it up, and you in fact explained the importance of what are the things that we as a women need to take care. So that's really, really amazing. So in fact, I would take some few questions from from my students. Anybody who would like to ask any specific questions to Dr. Pooja, then you can raise your hand. I will unmute you. You can ask directly to Dr. Pooja. So anybody who would like to ask any specific. Okay, yes, we have Ritu. Yes, Ritu, can you please unmute yourself and ask the question?
Okay, hello. Am I audible, ma'am?
Yes, we can hear you.
Yeah.
Pooja ma'am, I want to know about the cervical cancer. Actually, I believe there is a vaccination for that, 3 doses. So one should go for that, or because somebody told me that we can give that vaccination to the teenagers as well. So is it, I mean, what do you suggest? We should go for that, or it's not required? I mean,
So one thing, Ritu, first of all, hello, hi. And it's a great question, which most of the Indian women would love to hear also. Cervical cancer is very prevalent in India. Okay. And when it comes to the history, for example, Ritu, when you're asking if there is a strong history of any grandmother or a mother was suffered from any cervical, problem or any cervical erosions or a lesion or anything, taking this vaccine makes lot of beneficial for this generation. Okay. With regards to the teenagers, you need to really evaluate their menstruation pattern and then get this vaccination done. Okay, because the teenagers these days are dealing with a lot of polycystic ovarian disease and syndromes. Okay, so just to know that their cycle pattern is normal, and then give them this vaccination. And it is good to take this. Prevention is better than cure. So it's good to take the cervical test.
I don't know whether this is a myth, or because few people are saying that teenagers should not get it, then there is a problem in pregnancy to conceive. So is it, is it true? Because
no, nothing like that, Ritu. They can take it.
Can I ask one more question? As you said regarding the calcium, so do you think that we should take a break after 2-3 months after taking calcium regularly, if we are taking it for 3 months?
So Ritu, it depends on your consultant. Okay, if you ask me, how do I give my patients is, I give a combination. I give them first month a calcium, okay, followed by an antioxidant a month, followed by an iron a month, then ask them to be on a free, nothing, no treatment for 3 months, okay, then come back after the 3 months. So then I evaluate them. I ask them, do they have any back pain or anything at all, based on the symptoms.
Okay.
Continuously taking calcium may not help, but yeah, you can eat food which is rich in calcium all the time. So maintain that calcium level in your body.
Okay. Thank you so much. Thanks a lot.
Thank you.
Thank you, Ritu, for the question. Yeah. All right. So anybody else who wants to? Okay. Yes, Priyanka. We have Priyanka. Yes. Unmute yourself.
Hi, good evening, ma'am.
Yes. Good evening. Yes, you can ask it.
Ma'am, my question is about irregular periods in women. So there are irregular periods, and the flow is also sometimes irregular. Is it due to menopause or what is it? And how can we do something about it?
So irregular period is something, if I'll just brief it, okay, Priyanka, to you. If we actually sit and talk about it, it takes a lot of, more than an hour. Okay. But just to brief it up, it depends on what age are you having your irregularity of periods. Okay. First is that. If it is in a younger age, what it is. If you're in your early 40s and all, what it is. Okay. Then comes your hormonal evaluation. We look into your follicle stimulating hormone, we look into your luteinizing hormone, and also your anti-Mullerian hormone. Okay. So these levels we do evaluate, and also we evaluate your testosterone levels also. So when we look into all these patterns along with the ultrasonography, we see that what is happening in there. Okay. And we rule out all the basic causes for it. When it comes to your irregularity, it can be anything. Okay. A basic one is recently, which we see in every girl, is about polycystic ovarian disease, which has been, a very routine diagnosis. And why is it so? How is it so? It's always a lifestyle modification which we recommend them to go through, apart from all other, medications which we give. Either you ask a allopathic doctor or any other doctor, they give their respective medications to look into they have a normal menstruation. But when you look into your menstrual pattern, is it the same? For example, before having one baby, there is a set of periods that you have. Every 3 days, you'll be menstruating for every month or something. So that something is fine. But after that, is it the similar pattern, or is that changing something? You're menstruating a week before, a week later, it's still normal. Okay. But if there is something change, you're bleeding heavily, or you're just scanty flow or something, go get yourself tested first with your, is there any less hemoglobin in your body? Okay. Get yourself a systemic evaluation done also, not only just with investigations. And then rule out all causes. Is there a fibroid? Is there any endometriosis or any edema is there? Anything that can cause this irregularity. Irregularity, what I mean is, Priyanka, is either you bleed more or you bleed less. Okay. With respect to your menstrual pattern. Okay. Thank you.
Okay, thank you, Pooja, for that. Thank you. Anybody else who have maybe one more question can we take? Right. Okay. Pranali, yes, yes. Can you unmute yourself?
Yes, hello, ma'am.
Yes.
Actually, my question was about menstrual cups. So, like, how do you get the perfect size of the menstrual cup? Because ever since I got my period, I've been using pads, and my work didn't allow me enough time to get it changed or, be worried about the whole charade of whether there is something happening behind my back. So
Right.
I once tried the menstrual cup, but it was really painful.
Hmm.
I couldn't use it throughout the day. I just had to go and remove it and use the pad again. So if you could just tell us how to choose the right size or right product or anything.
So Pranali, this is something new for the Indian women because most of them have
Right.
not used it. So when you talk about menstrual cups, these are silicone based cups, okay, which is you can, turn and twist it around any shape and size, and you can insert to yourself inside. Okay. The quality of what it is made matters there, which will not hurt you if it is made of silicone. And you can, clean yourself. For example, go clean it out, clean your menstrual cup. It can hold around 60 to maybe 70 ml of blood there in the cup. Okay. Clean yourself once in 4 to 6 hours, and then insert it back. This is for the why the menstrual cup has come back. Just to give a one-liner to you all, if you talk about the pads, to recycle them and get it back. One pad, if you recycle it and biodegrade it, it takes more than some 800 years. So if we talk about ourselves, we use how many? 5 and into 2, 10 pads a month. That's minimal. And one woman using 10 pads a month. And what about rest? I can't say that. So just to bring the green effect back and maintain the uh, horizon level and the ozone levels also. This is what we are trying up is the menstrual cups. You have to check what material it is made of, Pranali.
Pranali, I hope you got the answer that you're looking for. Yeah. Okay. Great. Okay, so who else? I think last one more person, and I'll take one more person question. We can. Komal is here. All right. Komal, can you unmute yourself? Yes.
Good evening, ma'am. Happy Women's Day to you.
Happy Women's Day. Yes.
Actually, my question is regarding PCOD. I'm just 23, and from past 5 years, I have been took homeopathy medicines for PCOD. But from past 1 year, I would like to share this that I've stopped my medicine. I'm not taking any medicines at all. Like it's been a headache for me that from past 4 years I was taking medicines, but it didn't work for me. And the doctor was like, once you get married, everything will be sorted. But now it's been a headache for me. Like in a year, I get like only for 2-3 times I get periods, and the last period was like in October. So now it's been a headache for me. So what should I do for that? If I will go for allopathy, so my family and everyone are just saying me that allopathy is harmful to you. So don't go for that. I'm not at all helping myself. That what should I do for me?
Okay, got you, Komal, completely about your PCOD problem which you're dealing with. So one thing, Komal, what I would like to address is what I do for my patients. I have many of these teenager girls who come up with this PCOD problem. Okay, so what I ask them is, what is your schedule? What do I mean your schedule is your eating habits, your sleeping habits. Is it the similar pattern? Like if you sleep today at 10 p.m., are you having that practice for the next entire month? And if not, bring that in. And what do you eat? Are you eating the lot of junk and not nutritious food? Most of the times the teenagers these days, what I listen is I've eaten nothing from homemade or something from outside and all, and which is used with lot of any color agents and all. That definitely affects your hormonal balance too, because it's not nutritious at all. So this is something, what you can bring forth in lifestyle modification is this is what it is. I would not deny that either it's allopathy or homeopathy or Ayurvedic. Everyone is just in the search to bring a remedy for this polycystic ovarian disease. And everyone's giving their best. Most of them have given it and they have seen certain results. Few of them are not responding to it. So what? It's fine. But what you can do is bring a certain set of discipline to your eating and your sleeping habits. Lifestyle modification is in our hands and we can take care of that part. And I think once you start doing this, it will bring a lot of changes there in your hormonal balance. And then everything will be sorted out. Otherwise, there are n number of medicines and, uterine tonics and all. They are there to support you.
Komal, I hope your question is answered. Yeah. Okay. Anyone else who wants to have like anybody else anything that personal questions you have, one personal question you want to ask, take this opportunity if you really want to ask anything, and then we can we have our second guest for the day. Even she's waiting. Okay, Tejal, right? So yes, Tejal.
Yes, Sophia. Hello.
Yes,
Happy
Tejal.
Women's Day. Sorry, I
Having
joined little late. Yeah, I've just missed that. Actually, I've gone through the PCOS. Like it was a partial hysterectomy. After that, no, I feel like my stomach is not. It's like bulgy itself. How many exercise and running I do it, it's not getting it flat. So what we can do it is a diet we have to follow, or what we can do for that. That's this is the question.
okay, yeah. Over to you, Pooja.
Got you. Got you, Tejal. So you've undergone a partial hysterectomy.
Yeah,
What do you mean by partial hysterectomy to the crowd here? Is
actually
that,
my uterus is then removed. I
yeah.
had okay, I had two uteruses, which was
Hmm.
abnormal, but it
Hmm.
has been removed. And after that, my stomach is becoming more bulgy. Even after running and doing exercise, lots of exercise, yoga and all,
Hmm.
I'm not able to reduce it. So what is the reason behind it?
So one thing, Tejal, when I listen to you, is it's most regarded to your weight management.
Weight management, right?
Yeah. So for weight management, there are n number of things that have come up today. So one thing which I really suggest to all the women here is, what's important to you. What I mean by is, good, you reminded me, I forgot to share about this, is the core strength of you. When I speak about you, I see Rekha here, I see Priyanka here, I see all of you. Are you having that strength enough to do the work which you love to? For example, Tejal, you have fat so much and all, I mean, like, fine, are you able to do that kind of work which you want, even being fat, and then work on slowly in sculpting yourself? For what you need is stretches or yoga or Zumba, whatever it is. And maybe for how long you need to do that, you really have to talk to a dietitian with regards to your food there. Fat is something and cellulite is something which requires a lot of work. The water fat, whatever it is there, you will lose it very quickly. But when it comes to that hard one, you really have to step up. You have to go that extra mile to work and burn it. And that doesn't happen with just, if you run for 30 days and you say, I've ran for 30 days, there is no result. If you ask me, Tejal, I'll tell you, run till you get a result. You are not going to stop till then. Is she there?
Tejal, is your question answered?
Yeah. Yes. It has been answered. I've been running since 1 year. Okay, and I think I should follow the diet. I think I'm running for 5 kilometers, and still I'm running hard for 10 kilometers.
Hmm. Hmm. Hmm.
The difference is there, but not what the result I want. I have not achieved it. So as ma'am said, I should run more and more. I'll
Right.
try for that. Yeah.
Right.
And look
Sure.
into the other aspect also. It's bringing fitness to you, then you should continue that.
Yeah.
Don't say that, okay, 1 year or 2 years.
Yeah.
Just run.
Okay. Thank you so much, ma'am.
Yes. Great. Thank you. Thank you. All right. Thank you, everyone, for those people who have questions. And that was amazing. And really, thank you, Pooja, for your time. Being here was an amazing, absolute amazing opportunity for, to really look into the different aspect that what all women deal in our life, right? So that's great. So amazing. Happy Women's Day to you again. And we will again have you sometime like later when we again organize any other something similar event for the society, for our community, for our students. So thank you so much, Pooja. If you want to stay, you can be in the event for some time. And and we have our second guest, which is like she's waiting. I'm just looking around. Where is she?
Thank you, Sophie, and thank you, everyone.
Yeah.
Bye-bye.
Thank you, Pooja. Thank you for being here. Thank you. Okay, so let me bring on our second guest. Yes, Dr. Swapna. Yeah. Hi, Swapna. You can unmute yourself. Maybe I've sent you the prompt. Yes. Yeah.
Hi.
Hi. So amazing to see you after a very long time. So that's so amazing. First of all, let me introduce to all of you, right? You know who is Dr. Swapna. Dr. Swapna is an amazing, first of all, amazing human being. Let me say that first, an amazing soul that I know, and she runs her own. You have your own school, right, Swapna?
Yeah.
Yes. So in fact, rather me introducing, I want Swapna to introduce herself in such a way that, everyone knows that who is she. She's doing a great job. She's an amazing human being. She has been contributing to people's life in a different dimension, and, not only in the world of, medicine or any other, medical way, but also in a holistic way, in a holistic healing, a lot of things that she's been doing. And I'm really privileged to have you here, Swapna. Thank you so much for being here, accepting our invitation. So over to you. I want you to first of all share your journey, right?
Right.
And why are you here? First of all, is that I want everyone here in our student community who are here, right? Some of them are healers, some of them are teachers, some of them are business women, some of them are doing their work, and in fact, this is all women community, I would say. So the main topic for right now for today's discussion is all about the women entrepreneurship. Like, as the women, what are the things that we face as we want to start a new business, and apart from the things that we do, right? And you are the classic example. You are a doctor, you are a holistic healer, you are internationally, you have gone through to so many places where you have conducted so many other sessions. At the same time, you are an entrepreneur doing a great job to the society, and your contribution is amazing. So rather I say a lot of other things. I would rather you to introduce and talk about your work. Like, first of all, I want you to talk about your work. How is it, from where you got inspired to do that first, and then your journey to be an entrepreneur, right? And the vision that you created for yourself, that was amazing. I was very inspired by that, right, when you shared about your vision. So over to you.
Right.
All yours. Yeah.
Yeah, thank you so much. First of all, I want to thank Sophia for this opportunity that she's given me. And it's amazing to be in this space and to contribute whatever I have had my own set of setbacks and my own set of successes, or whatever in my own way that they are there. And I'd be more than happy to share that with all of you. So thank you for this opportunity, Sophie. And I'm so happy to see Pooja as well. So happy Women's Day to all of you. And so to share a little about myself, I'm basically a dentist. I run a center for advanced dentistry in South Bangalore. Okay. And before that, I was into clinical research. I was into scientific biomedical intelligence. And I got back to practice because that's what I loved the most. And now, so my children go to an alternative school. And so we were looking at sustainable living in the sense Pooja spoke about, like, one thing, the kind of impact we have on the planet, that we are alive on this planet and we are at the juncture of so many things on this planet. Our children are going to have many more challenges to take care of. So for me, since I chose dentistry, I practice dentistry, and that happens to be my passion as well. So I'm bringing in integrative medicine, which looks at human beings not just in the physical essence, like how you as spiritual healers know what I'm talking about. It's the emotional health, the mental health, the psychological health, which shows up in the physical health of the person. So that impact we have in medicine, and we also look at bringing that in education. So we run a Waldorf inspired school, which looks at it on similar lines. And we also have integration of children with special needs. Okay, so how we look at special needs children are that they are gifted. They're gifted in a different way. And in our fast-paced life, we do not have, or we do not stop by to look at what is that they are offering as a gift to humanity. Why did they choose to be born as special children? So, so in the school that we run, I head the special education segment. Okay, and I'm training myself in special education just to run the space well. I won't be a teacher, but I'd be somebody who will be overlooking them. And the vision in the long run is to have a vocational center and a residential setup for adults with special needs. So that's pretty much about what I'm doing in life right now. So so practice happens. So what I want to set up right now is, so I think what also is a basic challenge for me is that being a mother equally. Okay, and I say we go to an alternative school. My children follow an alternative system where it's lean on technology. They're not glued to video games. Then you have to creatively engage them. So being a mother, being a clinician, and looking at what is the calling for my life. These are the three things I'm handling right now, and I'm my own hiccups. And yeah, so I'm doing whatever I'm doing. All right. So at this session, I don't want to talk more about myself, but I want to hear from the others. What are the challenges you are facing and what you're doing, and what can be my contribution in sharing my experiences to see what we can do together to address that.
Yeah, that's really amazing. And thank you for sharing about the whole aspect of like you being a mother, being a woman, like, and women has like a multitasker. We all been known for that, multitasker. We do take care of everything, and it is always something like a woman has been expected out of it that we will be good at it, multitasker. And whether you are good at, whether you are not good at the end of the day, women end up being everywhere. Right. So the whole point, what we are going to discuss today is that as an entrepreneur, what are the challenges that women face, right? So in fact, I want people to raise your hand and ask about if you are somebody who really want to be an entrepreneur, or you want to start something for yourself, or you are in a journey that you started something for yourself and you are in a mid of your journey, and there are certain challenges that comes up, anything that you want to ask. So this is going to be a live interactive session, so where you want to ask something and then Swapna is here to answer, right? So anybody who wants to ask, you can raise your hand, your virtual hand, and I'll call out your name and unmute you. While people are just doing raising their hand and getting into it, there are a few questions that already some of the students have shared, Swapna. And
Right.
in fact, I would like take on from there, right? So yeah, one of the questions that one of the student has asked is about the marketing, like customer queries, or handling the customer, or managing the staff and the management altogether. Like when you start something, I think what she wants to understand is how to manage the staff, how to manage the marketing staff, the how to handle the customer or a client as you start as a newborn entrepreneur. Maybe this is something that she wants to hear. Yeah.
Right. So what I understand, Sophie, in this question is that as a small space, as a new company or a new startup, how do you manage staffing and manage marketing? Is that what it is?
Yeah. It can be a small scale business by herself, started something. Yeah, anything. Yes.
Right. So just to give a sense of where I am coming from. So during my studies, what I really saw as a huge vacuum is that they just taught us medicine. They just taught us how to treat disease. Okay. They didn't teach us how to manage practice. Okay. Coming to a city, I came from a small town. So coming to Bangalore, practice management was a whole ball game separately. Dentistry was a separate thing. Marketing and practice management was another thing, total things. And I really, it took a while for me to make huge mistakes to really get to an understanding of what were my mistakes in the first place. Okay, because I thought just knowing my subject was sufficient to run a practice. So now coming to straight away, I'll tell you. So when you are starting a business, you have an idea. Okay, so in India, how we look at it is that you fairly have a sense of how you got to do. Either you look at your peers, or you look at somebody else, or you look at some videos or some movies, you get some ideas, and then you go about with your own inputs, family inputs, and the kind of upbringing you have had, and then you'll go and do something. Sometimes it works, sometimes it doesn't work. Okay, so now there's a management tool called as the canvas, the business model canvas. Okay, and there are 9 questions to that. So basically the business model canvas is designed in a way that it asks you 9 questions about your business. Okay, like what segment are you looking at? Who are the people you will, like what are the pathways of reaching that people? So these are systematic questions that have worked for people over years. Okay, and this model was there a few years back, and then it just came out as a PhD study, and then multiple businesses across the world use this model, and they saw that reviewing your business, whether you are a small business or a big business, you sit through, you Google it, you get this template, okay, where you as a business owner get a sense of, so you start introspecting at the various aspects. When I believe me, I thought I knew everything about my business. Okay, what is there? You're a dentist, right? You put up a clinic and people have to walk in and you treat them. It's as simple. But once you start writing it down, once you start enumerating and doing it the way it is meant to be, you will get clarity around how and where you have to focus on. So initially you might not need a marketing staff at all. Okay, and you would also look at it creatively based on the budget. Maybe you did not allot a budget for marketing at all. Let's look at another thing which I want to really focus on is lean startup. Lean starting is reduce your overheads as much as possible. Now, I'm not telling don't put money. What I'm saying is keep that money for reserve if you have that kind of funds, but see how you can bootstrap yourself from the beginning, like as minimalistically, as step by step you're going. I'm not saying underplay yourself, but don't overspend. Don't overspend from ignorance of not knowing what to do. Okay, so what you need to really bring forth is creativity. What can you do to be the optimum version of yourself is the first and the most important criteria, inside of which you will manage your staff, you will manage marketing, you will do everything. What does it take for you to focus maximal? How can you step up that game? Okay, and then ask the right questions to yourself. Take random interviews from people who are not related to your business, who you just get to hear from them what are their inputs around you. Suddenly you don't know where your eureka moment lies. Okay, so don't really invest on or think about a marketing budget right away. Okay, first understand who your segment is, like who so you bottleneck all your ideas, bring it down, and you focus on the major 4-5 strength areas that you want to look at, and specifically for that target you look at, okay, who do I want? Like for example, if I want to treat older age group of patients, okay, when I'm looking at anybody who's 50 and above, I cannot do a Facebook ad. I don't know even if, like, if I'm looking at teenagers, then maybe Facebook and Insta ads will work. Or I have to put it in a way that their sons and daughters look at it and they think of their father and mother. And my ad has to be appropriate, that link, that ad rings a bell for the son or the daughter to think about their father when they look at the ad, not about themselves. So it's not about the marketing budget. It's not about, any marketing guy will do whatever you say. You give them a budget, they will find hundreds ways to spend it. It's you. Your marketing is you. Okay, not the marketing guy, not what the promise is anybody else.
I agree that, Swapna. I absolutely agree that, because at the end of the day, it is you who are designing it. At the end of the day, it is you, your vision, what is that you want, and then, as you said, right, you narrow it down and find it out what is that you are good at, or what is that you want to cater, or whom you want to cater, or what is that you really want to you want people to know you. One important thing, like, because a lot of people does a lot of things and nobody remember a lot of people who does a lot of things.
Yeah,
people remember you because you do that one thing which nobody else can do.
Right.
And you designing that and narrow it down, which Swapna really beautifully said, and I think that's something that I totally agree with. I think this is one thing that as a women, when we start something from the scratch and when we are doing something for ourselves, this is where I think we all should start it off and try to focus and be clear, crystal clear about what is that you want people to know you about. Whether you're doing a service or whether you are selling a product or whether you're giving a service, both are same in that way, right? So that's great. I saw Komal raising the hand, so I'm going to like unmute Komal for this and let me take the question from Komal.
Good evening, ma'am. Hello.
Hi, Komal. Good. Yes, good evening.
Actually, my question is regarding time management. Like, if I would say that I don't have my mother, I lost way past like when I was just 6 months old, and now I'm having just my elder sister, and old. My granny is very old in age, and my father is busy in his work, so I have to manage. Like, I am a spiritual healer, so I have my clients too, but I'm not able to manage the work of my own self, like my healer, my tarot business and all. And at the other hand, I have my household work too, and I'm unable to manage everything at a one time. So what should I do for that?
Right. Okay. So here again, I bring the same concept of go lean. Okay. Now there are different ways of addressing this. So you want support with your tarot business or you want support at the home front. That you have to figure it out. Okay. And then in the home front, if you need support, what are the different kinds of ways and means of doing it? Okay. Now again, are you looking at cooking or are you looking at support in the household work or what is it? Okay. And first of all, come with that mentality that you can create a solution around this. Don't approach it like this is like I'm doomed, but still let me try to do something. It doesn't work that way. Okay.
Yes, so I think Swapna, let me like sorry to interrupt that. I think what Swapna trying to say to you, Komal, is that don't approach your time management as if it is too much burden or something that you can't do it.
Right.
Like you are operating saying that, oh my God, I can't do it, but let me do it like that.
Yeah.
When you do that, the context that when you do that, and you will end up not having the enough time for yourself.
Right.
That's what Swapna was trying to say. Yeah.
Right. So so one of the situations where I had is like I said, I have two businesses, major businesses that I need to manage and give my time in. So so what I've done is I've tried to work around the work front from home. So first I got a cook who used to do a lot of work, and then if one day she doesn't come, my world is gone, like really. So then like divide it among people, like for cooking separately. And so if a maid doesn't come for a day, or she's not coming like for 2-3 days, then your world should not shatter. Okay. So you look at it like that. You either pre-cut vegetables or you set your menu up in a way that's not that, like you manage yourself to handle emergencies also. So that should be the level of planning, not end to end. I'll do things comfortably, fine. But what if there is a stretch? That's where you experience a breakdown. So then you look at that also. At work front also, I had to like, there is no one solution at the first time. Maybe for some people it might work, but I had to try with my juniors what kind of residents I wanted, what kind of consultants I wanted. Then I saw it stepping up my support staff, who are non-doctor staff that is there. I started increasing the kind of work with them. So I started creatively distributing work such that if one person doesn't come or if something is not there, the whole world does not shatter. Okay, are you getting what I'm saying? So start looking at your immediate family. Yes, I understand your partner is busy, but what can you do in a way that he still will be able to support, not exactly the way you want it, but can he do something more than what he's not doing right now? Like, don't discount anything. Everything is a potential. Everything can bring you something that you didn't think of. So look at it like that, and something will open up for you. I don't know what exactly will open up for you, but permutation and combination needs to keep happening all the time. Then there's room for more.
Yes, thank you, Swapna, for that. I think, and one thing for everybody, right? And some of the people, some of the student has also put up questions, and I'm just clubbing everything together and asking you. So, what is your perspective about as a woman, when a woman become an entrepreneur or doing a small scale business or a large scale business or starting a company or anything that sort, when they become something that, like when I say something, when they are becoming or they want to become an entrepreneur, what is your what I would say your advice, or maybe your suggestion, or maybe something that you think from your experience that you want to share to everyone here out here?
Right. So what I would definitely say is that your responsibilities at home remain. Okay, that will always be there, and everybody is going to like we can't really not be a sister, not be a mother, not be a daughter. Okay, that's given. With that, how can we look at aspirations and dreams that we have? And it's not going to be like a red carpet situation. Okay, so there will be situations which will demand and always be ready for permutations. And when I say permutations and combination, what I mean is, you thought this will take care of this, like, I'm putting my child to school, suddenly there is like a lockdown, and now the child is at home. Now what do I do? Okay, I am supposed to be a healer, my clients are calling me, so but my child has made potty. Now I have to go. I have small children, so this is an apt example I have. So
Yeah,
I can't
absolutely.
really, my daughter says this, I can't just say like I don't know what you're talking. Of course I know what she's talking, and you need to manage that. So you need to really balance that as well, and then like take time off. I don't know how that works. So it depends. So I remember a situation where I had to go to work with my daughter being just 3 months old. And I had taken my daughter to the clinic. I had kept one room as a nursery for my daughter. And I believe in breastfeeding for a longer period of time. So this happens when my daughter is still 1 year old. Okay, still within 1 year. So she was sleeping, and then I was treating a case, and then she woke up, and just she's not willing to budge at all. Okay, she's just not listening. So then the nurse comes and tells me that the child is not controllable. So I had midway in the case. Okay, I tell the patient, see, I have to feed my daughter. Can you wait for half an hour? And then that man was generous enough to give me that time. I went, fed my daughter, came back, and completed the case. So there is nothing like this. This was something which I still remember. And all the patients who had come during the time when my daughter was a baby, they asked me, "How old is your daughter now?" Like all remember. And now I have forgotten about it now because she's like 7 years old now. So everybody still remember. I'm like, oh, there was a time when I used to bring her to clinic. Now that's like a memory, right? So we don't know what works. So you cannot really tell you can't do this or you can't do that. You have responsibilities of home, that's primary. Around it, we still have to take our dreams to the place we want to take it. How do we want to take it is up to us. To what extent you want to take it is up to us. We have to be creative and see what works. That's all I can say. And build the right kind of ecosystem around you.
Yeah.
Like speak to people who resonate with you. Have your energy boosters. The day you feel low, you immediately don't give yourself the 20-minute rule. You will not be upset for more than 20 minutes. Okay, do whatever, jitna bhi rona dhona, drama, whatever you want to do, finish for 20 minutes. At the end of 20 minutes, you're back to work, and back to work with full energy. And you ensure that you have people who can pull you out of it. It might
Who
not
can
be
pull
really.
you and support you. Yes,
Yeah.
I completely get that. Yes.
So,
and in fact, what you said is so right, because something that I practice, like I don't get upset more than 5 minutes.
Yeah.
Really, if I'm upset, right, I just count 5 minutes and I'm out of the upset. And in fact, that is something what you said, right? And I mean, as a newcomer, I mean, each one of you can start practicing this. By the way, this is a very good practice, that you are not upset more than 20 minutes. Like, how's that life going to be when you do that? I mean, imagine life without upset. Like, when I say this, I'm sure you will be like, how is it really? It is possible? Yes, I'm sure it is possible, because when because who can make it? It's only you and I can make it work. Nobody else can do can't do this for us. So it is we, and that's what exactly Swapna said. And thank you for bringing that, because I personally practice that, and it is amazing to see ourselves that yes, like you get angry very fast, and look at how quickly you can cool yourself down, like that kind of practices. So yeah, and especially when you are an entrepreneur and when you are moving out in the world, a lot of sense of calmness is required, right?
Yeah.
A lot of sense of calmness. And one thing I'm taking away from the discussion that we are having with Sapna is the lean factor and the creativity, which
Yeah.
is something that I feel that creativity is the one that keeps you always grounded and expand yourself. And I think that is something that I'm taking on from today's discussion that we are having today.
Yeah.
Yeah. Thank you so much, Swapna, for your time and for accepting my invitation and being with my student here. And I'm sure all of you have got some kind of idea, or also, maybe some form of maybe inspiration that you're looking for, or something that you wanted to get today. I'm sure you got some value out of today's session. So thank you, Swapna, for your time. Thank you everything for whatever that you have, contributed to my student here. Thank you so much.
Thank
Yeah.
you so much, Sophie.
Thank you. One last word, one last thing that you want to share, you want to tell to everyone here?
Yeah. So don't give up anytime.
No
matter how difficult, no matter how challenging, how upsetting, how impossible it looks, don't give up. Because you are the only person who can cause your dreams, nobody else.
Oh, I love that. I love that. Yes.
If you don't stand by it, nobody else will. So please, you cannot hand it over. Your dream is not anybody else's. Okay. Something, if you stand by it, there's this Shah Rukh Khan movie which says like, "Kainat aa jati hai complete karne ke liye." Something will work out.
The universe will come and help you. Absolutely.
Yeah.
Absolutely. Thank you so much for that last word that you gave. And it was amazing. And really, for me, it is like, while we're having this discussion, it's not that we don't talk about this before, but then we don't know about this before, but then when we discuss and when we talk about it, there is always something opens up. And it's really an amazing discussion that we're having today. Yeah. Thank you so much for this conversation. Thank you for the time. Thank you everyone out here, all my students who are here and participated, and really appreciate your time. Really. Thank you so much.
Thank you so much. Thank you for the opportunity, Sophie. And thanks everyone for listening. See you.
Yes, they were eagerly waiting.
See you.
Yeah,
Bye.
thank you. Bye. All right, thank you everyone who are watching live through YouTube channel. Thank you everyone for joining the channel and being here with the community, being here with the people around, with your family if you're listening with. So I hope today's session has really made a difference in your life. I hope this session has been an informational session, or something that you have been wanting to hear about your health, about women's health, about being a women entrepreneur. There are different other challenges that we keep facing in our life. So maybe again in the next coming up, maybe some kind of event that I will organize, and where I can invite a few more people who are achiever in their life, who have created a lot of difference in people's life, so that you can really make a difference when you interact with them and get inspired by who they are. So I really thank our guests today, Dr. Pooja and Dr. Swapna, for being here with us. And thank you all the viewers who are watching our channel. Thank you so much for joining.